The ASH 2024 meeting has been quite exceptional. Before coming here, I was not sure what to expect, but we saw data being presented that further moves the needle forward towards better treatment of myeloma. We were all excited to see updates regarding some of the ongoing clinical trials, particularly with CAR-Ts. And for the first time, we'll see a robust report on one of the new CAR-Ts of anito-cel, so I think everyone's very excited to see that. Having said that, the data that has been presented with regards to bispecific antibodies is pretty remarkable. There are two presentations that caught my eye. One was the use of Teclistamab for frontline therapy for patients who are transplant eligible, where the numbers are very small, but all patients become MRD negative. So I think those levels of response are really unprecedented. Likewise, we saw a study using Teclistamab as maintenance therapy post-stem cell transplant. And once more, all patients became MRD negative. Now, the caveat with this, these are small numbers, but this could be a total paradigm change in how we approach frontline therapy for myeloma. And those numbers holding, that means that then a substantial number of patients might have a very durable disease control. So I'm very excited about that. We saw some updates with regards to belantamab as well, too. People are interested in this because it's an active agent. And one of the most interesting ones is upfront use of belantamab, where it was shown that the combination is highly efficacious, perhaps even better than what we're able to achieve currently with daratumumab. Of course, there's trade-offs because there's a toxicity with the keratopathy, so we'll have to wait and see further where that goes. There's some new molecules. There's some degraders that are being presented, as well as a P300 inhibitor, which seems to have promising activity. So all in all, I think it was a wonderful meeting.